Hello,
Hi, Craig.
how are you?
Okay, Craig, what's up?
Not much. How are you?
Long time no see. How are you?
Yeah, good. Very good. Hang in there.
That's,
Greg,
that's
how
what I
are
say,
you?
Hi.
everyone.
Good. How are you?
Good, thank you. Nice to see you.
Nice to see you as well.
All right, good evening, everyone, and welcome to the May meeting of the Revere Board of Health. My name is Michael Wells, Director of Inspectional Services. In attendance for tonight's meeting are board members, Chairperson Dr. Nathalie Kong, Board Member Nezza Luwadi, and Board Member Dr. Craig Costanza. Also in attendance for tonight's meeting are City of Revere staff, Director of Public Health, Lauren Buck, Paula Sepulveda, and Marcia Mendez, Administrative Assistants. On tonight's agenda, first topic is heating variance for the Breakers condominium located on Ocean Ave. So in regards to the heating variance for the board members, this is the same as last month when the St. George applied. This is a high-rise building located on Ocean Avenue. No, I'm sorry, Breakers on Revere Beach Boulevard. I'm sorry. I was talking to one of the condos on Ocean Ave for the same thing today, so I apologize. So the Breakers is directly on Revere Beach Boulevard and counters the same situation as the St. George, where they get direct sunlight all day long. They are currently looking for a variance to apply for to be able to turn off their heat, and they're looking to do this from May 15th to October 15th, which is the same variance that we granted St. George condominiums last month. Anybody from the Breakers like to speak?
Yep, I'll start. So we wanted to thank you for the opportunity to speak tonight. And one of the things that has happened since I've purchased is global warming really has warmed things up. And it's great in the wintertime because we have less snow, we have less ice, but in the summertime, we get summer temperatures in April and for a couple of days, and then a lot of days in May. So we have residents in the building who have health issues. And so for the heat to be on when it's so warm outside, it's really a detriment to them. The other thing that happens is because the Point of Pines station hasn't happened, the apparatus take the boulevard as a shortcut to get to Lynn and to get to the Point of Pines area. So at nighttime, we would love to open our windows, but it's so noisy with the big trucks going by, all through the night. It's just not possible. And then, as he said, we're requesting May 15th to October 15th. And we have portable heaters available to our residents in case someone's cold. But over the years, really hardly anyone has ever asked for them. And then the other thing that we always do is we have a survey where we ask the residents to vote on whether they would like us to request a variance. And it's overwhelming every single year. We did it again this year, and not one person voted no. Everybody said yes. And it was over half the building that we got to actually sign the petition. So usually we don't get that kind of response for the things that we ask for. So this was, interesting that so many people wanted it. So we thank you for considering this, and we hope it passes. Thanks.
And I have nothing to add, Tina. I let her speak up on this, but all of those issues are true. And the real thing also is that, and she's on a lower floor than I am, but still, when we leave our windows open, there's so many more buildings on the beach that we hear all the car traffic and the people traffic, and it's just very noisy to keep our windows open at night. The other thing is very humid because we are right on the beach. I have asthma, for example, and the humidity that comes in, I just really can't breathe, even if it's a cool day like today. And so having the ability to have the heat off and the AC on earlier rather than later is, I know I'm not the only one in the building, is very helpful. So we appreciate your hopefully accepting our request.
Tina, are you a board member?
Yes, and so is Alana.
Okay.
We both are.
Awesome.
Yep.
Could you forward me the unanimous vote? It has to be 51% of the number of units in majority. So once the board votes, we'll be able to send that out to you.
Sure.
Okay. And so as far as the vote goes, Dr. Kong?
Yeah, I vote to extend I don't know the actual terms, but yes,
Okay.
I'm all for it.
Dr. Costanza?
Yes, I'll vote yes.
And Neza?
Yes.
Thank you. So the board votes unanimous to grant the breakers a heating variance from May 15th to October 15th.
That's what it
Thank
is.
you.
Great.
And I will send that to you by the end of the week.
Great. Thank you very much.
Okay,
Thank you
my
both
pleasure.
for coming.
Good night,
Thanks for showing
everybody.
up.
Thank
Good night.
you. Take care.
Take
Good
care.
night.
Okay.
I'm going to turn this over to Lauren Buck for the remainder of the items that are on the agenda.
Hi, Julia is on, who is going to do a presentation. Is she able to share her screen? I know she has some slides.
I'll make her a co-host.
Repeat, I'm not able to.
Okay, we're going to work on getting you access to the sharing the screen. So Julia is going to talk about a syringe service program coming to Revere.
Julia, I just made you a co-host, so you should be all set.
Thank you, everybody, and thank you, board, for allowing me to present tonight. I had a conversation with Lauren and Dr. Kong previously about bringing a syringe service program to the city of Revere, and I'm just going to quickly go over these slides with you to explain exactly what the role of the Board of Health is in implementing an SSP and really what they are, what the benefits are, and just a few local data stats that I can provide as well. So firstly, in terms of what a syringe service program is and the role of Board of Health, in 2017, Governor Baker amended Mass General Law 111-215, which basically authorized Mass Department of Public Health to establish an uncapped number of syringe service programs across the Commonwealth. Prior to this, there was only 10 pilot sites in the state, and this gave the DPH the ability to have an unlimited number of programs. What we would need to do as a Board of Health is develop or submit a letter of authorization stating that the city of Revere has approved for the establishment of an SSP within the municipality. And once we do that, DPH will initiate their standard procurement process and open it up as a bid to contract an existing funded SSP. A letter has already been drafted, so upon approval of this board, we're able to submit that. To give you an idea of what an SSP does, syringe service programs, they're community-based programs that offer access to sterile needles and syringes. They facilitate safe disposal and provide a link to other services, which include referrals to SUD-related services, screening and testing for HIV and viral hepatitis, education for overdose prevention, access to naloxone, how to use and safety, vaccinations for hepatitis A and B, screening for STDs, and referrals to social and health services and other mental health services as well. Some of the benefits of syringe service programs include, as of now, we know that infectious diseases like HIV and viral hepatitis are preventable. We also know that those who are active drug users do not always engage in treatment and in care, and this provides a low threshold option for accessing support. It's really a bridge to whatever next step they choose to take. SSPs, we know, are proven to reduce transmission of infectious diseases. At the same time, with the pandemic, we know that overdoses are at an all-time high. And as we continue to see an increase in crystal meth use, that also includes a lot of intravenous drug use as well. This is a really important point, which is that there are multiple pathways to recovery, and recovery is not a linear process. And so it's really our philosophy that we meet people where they're at And an SSP program will do just that by helping the person make healthy choices, like using clean syringes, like using in safety, wound care, so that they're able to continue on their journey of recovery. In addition, we also know SSP participants are much more likely to engage in further treatment if they so choose to. And lastly, they're cost effective with the return of $7.58 for every dollar that is spent. As far as some local stats, and I wasn't able to get a lot of it in the time frame, but I do know, this is according to DPH, that the prevalence rate per capita for HIV in Revere is 421.2 compared to the state rate at 337.7. Diagnosis rates per capita are 19.3 compared to the state rate of 9.7. And IV drug use was the cause of exposure for 29% of females and 6% of males. And as of now, we have 119 confirmed cases of hepatitis C. I'm happy to answer any other questions that the board may have. And again, thank you for letting me present.
Thanks, Julia. That was great. I know Dr. Kong probably has some things she wants to talk about, but I wanted to mention that, so there's currently great work going on with the program. And Julia, I'm hoping you can maybe talk more to the board about this with Health Innovations. And it's a program that is in Revere 2 times a week, who's doing STD screening and kind of case management work for a lot of people who, and their target population could potentially be very similar to the Syringe service program. So Julia, do you mind talking a little bit about what's already here in terms of Health Innovations and how it would tie into this?
Absolutely. So when we met with Barry Kessler from DPH, we explained to him that we have an existing relationship with Health Innovations, which is a community-based program that is in Revere 2 days a week on Tuesdays and Thursdays, and is located out of the SUDI office at 437 Revere Street. Health Innovations serves low threshold populations, people who inject drugs, individuals who are experiencing unsheltered homeless. They provide a plethora of resources, everything from like what Lauren mentioned, vaccinations, wound care, case management, and they are actually one of the community-based agencies that is funded by DPH as a syringe service program. So if, in fact, they decided to put in a bid through DPH to get the contract for the SSP, then it's a very good chance that we could have Health Innovations in the community for 5 days a week versus the 2 days that we have them as of now. And that would just, really create so many more resources for this population that we know has a number of complex needs, and Health Innovations really has the trust and has built rapport with this target pop that is really a difficult population to engage. And so we're really lucky to have developed this relationship with them through the HIV epidemic grant through DPH. And we hope to continue that process if the SSP is approved by the board.
That was great. Thank you all. I actually don't have any questions. I actually really am excited for this. I know a lot of other places, particularly clinics. Our clinic does not have like a safe needle disposal area, but other clinics, other community health centers, MGH have one. And it just makes sense. It makes the right choice, the easy choice for a lot of our patients who oftentimes are stigmatized or don't really have anywhere else to go. And they just kind of, unfortunately just give themselves soft tissue infections, endocarditis at the worst. So I'm not surprised that the return on investment is as high as it was that you reported in your presentation. So yeah, anyone else have any questions? That was amazing. Thank you.
I'll just say one more thing if there are no more questions. Julia and Dr. Kong and I think are all kind of the same mindset that syringe service programs really embrace the concept of harm reduction. And that concept in medicine is kind of evidence-based, that it's the right strategy, especially in the target population of what we're talking about here. And so although potentially there could be some maybe misunderstanding about what a syringe service program does, it really embraces the model that we meet people where they are. We try to develop wraparound care in communities where people are. And so, as a Board of Health, as a Department of Public Health, I know Julia and Dr. Kong also, are in the same boat here, that talking about harm reduction strategies, especially around substance use disorder and homelessness, is kind of the right way to move forward. And I don't know if you have more to say about that, Dr. Kong.
Yeah, I want to point out that you're absolutely right, Lauren. Harm reduction is really the name of the game. In a lot of instances, you have to meet people where they're at. And if this is where they're at, you don't want to ruin any patient rapport or any relationship you have with the patient, because otherwise, I think the worst thing is to have them walk out the door and never come back to see you again and seek care, any care whatsoever. Harm reduction has actually been used in a lot of other avenues too. When you talk about HIV and you talk about this concept of post-exposure prophylaxis. So if I get a needle stick at work, I, have a pathway to get tested, test the patient, and start myself on antiretrovirals to prevent myself from getting HIV. That's harm reduction for me, right? Making sure I reduce my risk of contracting HIV from a needle stick. We've been giving pre-exposure prophylaxis to a lot of our HIV positive patients, particularly men who have sex with men, to help prevent them from getting HIV. Just because or either help prevent them from getting HIV from their partner who is HIV positive, or vice versa. So this is something that is not foreign in medicine, and we've actually been using it. One would argue that harm reduction is like wearing seatbelts, having fire extinguishers, having fire alarms in your home or in buildings too. That's all reducing harm and just making the right decision, the easy one to make, or having it just baked into your everyday, so you don't have to think about it. So this concept isn't new. I just want to point that out too. I just think it's something that has been a long time coming to the substance use, coming to the population of patients who suffer from substance use disorder. So I'm glad we're taking one step in the right direction.
So Julia, the next steps at this meeting, I think, are for the Board of Health members to...
Thank you, Ellen. Yes, and that's really the philosophy. Take a vote. Can you hear me, Lauren?
Now we can hear you.
They would need to take a vote, and once it is approved, then we'll be able to submit that letter with Dr. Kong's signature as the chair. And then they would be able to initiate the procurement process. And it's the best part of this is that it's completely funded by DPH. So we're bringing in, a wide range of services that the municipality would benefit from across the board.
Yep. Okay, Mike, you usually do the vote. But I guess you want to take it over?
Sure. So we are voting on instituting the syringe program within the city of Revere, headed by Julia. Dr. Kong?
Yep, I'm all for it.
Dr. Costanza?
Yes.
And Neza?
Yeah, definitely yes.
Okay, voted unanimously. So Julia can proceed with the vote of the board to pursue this program.
Thank you so much, everybody.
Thanks,
Thank
Julia.
you.
Yeah.
Have a
Thank
wonderful night.
Thank you, Julia.
Thank you.
Thanks, Julia.
Bye.
Next item on the agenda, Lauren?
Yeah, so the last topic that we wanted to bring forward, Dr. Kong and I had been made aware of some ongoing kind of maintenance issues at the dog park, and how potentially if the ongoing maintenance and maybe cleaning up doesn't necessarily happen, in a consistent manner, it will, the dog park will end up being potentially a public health risk. And so I think we wanted to bring it forward at the Board of Health meeting, first of all, just to discuss the fact that, you know, a dog park is a public space and meant to be enjoyed by all. And we want it to be a safe and welcoming space and clean. And that part of that is being a clean space. So just, you know, bringing it forward that we need to continue to make sure that residents who use the dog park are aware of the kind of the responsibilities that come with owning a dog and using the dog park. Thank you, Mike. And so just to talk about that, and then briefly talk about kind of next steps if we continue to see issues with the cleanliness of the dog park. So first I'll just say, obviously we know that, you know, cleaning up after your dog and not cleaning up after your dog, if that continues to happen on a consistent basis and the park itself is, you know, dirty and there's, you know, dog feces or, you know, in the park, then it can be a significant public health risk both to the dogs and humans, and we don't want that happening. So there has been some discussion, and I think it's something that the Board of Health can talk about how we want to move forward about making sure that maintenance of the dog park happens. I also know that there's a potential for more dog parks to come to the city, so it's something that we need to figure out how to move forward on and have essentially a plan. Does that mean that we institute closings if we don't see the park being cleaned, you know, for a certain number of days? Does that mean we institute kind of a part-time or a temporary position that is kind of like a dog officer in the city whose job it is to go around and check that parks are clean and potentially maybe enforce some regulation? So really, I just wanted to bring it forward and remind Revere residents out there listening that if you are a dog owner, it's, you know, the responsibility that you clean up after your dog to make sure that the park is safe and healthy and happy and a good place for people to go, but also for the Board of Health to talk about how we want to proceed with enforcing the cleanliness of the park.
Also, as someone who has stepped in dog poop, it's not fun to clean it. So please, you know, if you want to take it selfishly, then yes, you obviously don't want to clean that stuff up off your own personal clothing and shoes. Summertime's coming, open-toed shoes are coming. That is where you want to be. Also, the bubonic plague happened because people were literally throwing out their like products, their bathroom products, like their feces and stuff out in the streets. So, you know, that's part of it. That's how it spreads. There's definitely fecal contamination, fecal transfer or of certain diseases out there, certain bacteria, viruses, things like that. So something to consider too. We've already gone through one pandemic. Let's keep it at one, please. Lauren, question for you. Is there signage? This is a dumb question. Is there signage at this park that says you must, you know, clean up after your dog or something like that?
So I know that there's, Mike, do you have a better sense of what the signage looks like currently there?
I don't recall exactly 100%. I mean, it's something we can probably stop down there and take a look at and see them, but just might need to be refreshed to get people's attention. You know, the dog park has been there for a number of years at this point, and you know, this is the first I'm hearing of an issue coming from there. So maybe it's time to just refresh the signage and, you know, get something that grabs people's attention to pop out a little bit. And also ensuring, you know, are there supplies there? I know there is a water fountain that, you know, DPW turns on in the summer for them to get some water and stuff. But, you know, do we have enough trash receptacles? And do we have, you know, maybe a dispenser with some plastic bags to be able to supply for those special treats?
Yep, exactly.
You read my mind. I have a dog. I'm a dog owner, so I go to a lot of dog parks around my area, and I always love it when they have when certain dog parks have the dispenser already. But having said that, if you're gonna create the garbage, you have to have a place, a receptacle to put them in. So maybe you should check in on that and see if
Yep, you can definitely do a site visit and check it out to see what we have there for supplies and if it needs to be updated.
Yeah, that's a great idea, Mike. I think maybe that should be our first step, just to refresh the signage, make sure it's super clear, the responsibilities. I know DPW is kind of at this point responsible for refilling like the bags and cleaning up the garbage, but I know it continues to kind of still be an issue. So we might need to revisit potentially enforcement in different ways. But I think the first step is a good plan that will kind of refurbish some signage, make sure it's very clear. And then we can always check back in, as the summer months come, especially if it continues to be an issue, we might have to talk more about enforcement and what that looks like.
The other thing to think too, and again, maybe for the summer months after we take this initial pass is, I know some dog parks also have like just once a year, they'll just like hose it down or something, right? Like, I don't know, is this AstroTurf or is this like sand? Like what's the composition?
I think it's crushed rock. Stone.
Okay, yeah, that's one that I take my dog to, something like that too, and they'll just close it for like a day or an afternoon or something and just hose it down and maybe just kind of, because the rocks inevitably move and get all over the place, and they'll kind of just clean up a little bit. So if that's something that we want to fold under DPW's purview. Again, something for later. We'll see how this initial pass goes and hope that our residents do the right thing.
Yeah,
we could definitely talk with DPW and see if they can get it some type of cleaning down there to start the season off right.
Yeah. Okay.
All right. Anything else on the agenda, or anybody have anything else? Dr. Khan, you want to tell people to go get a vaccine?
Yes, go get a vaccine.
Come on.
So the national average of getting a vaccine, the rate of people who've had a first dose in the United States has been stagnant. It's been at 44% for like the better part of the last week. That means new folks aren't coming in and reporting to start their vaccine series, whether it's Moderna, Pfizer, or just the one and done Johnson & Johnson. So that's a problem. Remember, 70% is the magic number to get herd immunity. So we're not out of the woods until we get there. Luckily for Massachusetts, we're leading the nation pretty much. We're at about 8%. We're almost at like 60% for first dose, and we're 38-ish%, almost 40% for fully vaccinated folks. So we are doing a great job. The city itself is also crushing it. We're in like the low 40s for first dose and 32% for
31.2 at the last time it was checked for fully vaccinated. And I think we're at 48, right? About 48% first dose. So we're hanging in there with the state average.
Yeah, we're almost at 50%. And remember, we want to be at 70% by July 4th. Great birthday gift to give our nation. So everyone get out there, get the vaccine. There is some talk about Pfizer applying for an EUA to give their 2-dose shots to folks as young as 12. Right now, we can only give it to folks who are 16 and older. And Lauren, we have a couple clinics happening. You want to tell us about where people can get a vaccine?
Sure. We kind of launched we're calling it Mobile May this month. Basically, it means that we are taking our vaccines and our staff, and we're bringing vaccines to lots of different places throughout the city. There is a calendar on the website that has a lot of the locations loaded into it. So you can go to the revere.org/vaccine and look at the calendar that we have created that gives a kind of overview of the month of where you can go to get a vaccine. A couple of things that I would just point out. Many of the clinics that we are popping up throughout the city are going to be at churches and mosques and shopping centers and our housing authority and other locations. The majority of them are going to be walk-up. So we are trying to eliminate the pre-registration barrier. So people can come to get a vaccine even if you haven't pre-registered. We are going to be doing a lot of weekend clinics to help try to get people who have significant issues getting out of work or something like that. So look to the schedule on on revere.org/vaccine for the clinics that are coming this month. There's a lot of options. We hope that we get as many people to get a vaccine as possible. And the last thing I'd say is we continue to have resources at the East Boston location, which is the Wonderland site off the Oceanside Ballroom, right by the Wonderland Tea Stop. That is continuing to run. They are actually potentially going to be starting to take walk-ups as well. So that will be even a lower barrier to get a vaccine there. We also continue to have clinics on Sundays at Romney Marsh Gym. Those will continue to happen throughout the month. So there are a lot of options. Get a vaccine at any one of them. No one's better than the other. All vaccines are good vaccines. So come one, come all.
And another plug too, we are, for any parents out there, especially with this talk of Pfizer, maybe even being extended to younger individuals, Lauren and I are going to be doing an info session, a Zoom info session or webinar with Revere parents this Thursday night. It's going to be May 6th, Thursday, 6 to 7 p.m. And we're getting all that information out via the public school system. So you should be hearing from your children about that, and they'll give you the link for that. But tune in so we can kind of discuss everyone's concerns and kind of go over myths and facts about the vaccine.
Yeah, we got the emails from the schools about it. Thank you guys for doing that. Yeah.
And I haven't confirmed it yet, Neza, but I think I haven't confirmed it yet, but I think we're going to have an OB-GYN specialist also attending that session with us on Thursday evening. So we'll have a specialist who sees pregnant women all the time and talks about fertility concerns for a living. She's going to be there and she'll be taking questions as well.
Yeah, that's awesome. That's very good.
Yeah.
I also want to mention to you guys, probably some of you knows, this is the month that we call Ramadan for all Muslims. And I've been reaching out to a lot of families and in the community that they don't speak English, or maybe they speak a little bit of it, and, trying to talk them to to vaccinate and stuff. And a lot of them, they cannot do it right now. And a lot of them they are interested. And they keep I'm still in contact with them, and they're willing to do it right after Ramadan. They don't want to do it because of the fasting. The last day of Ramadan, hopefully, is the 12th. And then the 13th is a big holiday for us. So the 12th, so we go by the moon. So it's one of those 2 days. Right after we should see a little bit of spike for people reaching out to get some more vaccination. I just want to mention that.
Thank you so much for mentioning that, Neza. I actually talked to my patient yesterday and she said the same thing. She's like, I'll come, just book it for any time after May 12th, because I'm fasting right now. That is totally fine. That is totally fine.
Yeah, and I just want to, go ahead, Neza.
No, they just they hear that they might get small side effects or get sick here and there. So they want to make sure when they do the vaccine, they can drink and eat and stuff. That's all.
Yeah, and absolutely. And I think that ties in well with two of our clinics that are happening actually on the 15th. We're going to be at AICP on Marble Street, and on the 22nd, we'll be at the Turkish Cultural Center on 500 Revere Street. So those two clinics are coming up.
Oh, that's good. That's very good.
Spread the word, Neza. Spread the word.
Yeah, I will. Quick question, Lauren. Do we, because I lost track, I've been out for quite a while now from the clinics. So do they still have to go to the website and register, or how does it work now?
Yeah, so that's the great part about all of these clinics that we're doing on the pop-up during this month. These clinics are going to be walk-up, so you do not have to pre-register.
Beautiful. Beautiful. Any words on the 12-year-old and up? I hear Pfizer, they're very close. I still have one more kid to do in my house.
I mean, I really hope so. I got my fingers crossed. I got my fingers crossed. Your kid's going to be the first one on the list. No, I got my fingers crossed. We don't have any word yet. I know they're probably going to apply, this week, Lauren? Yeah. They're going to apply, and then they have to go through the same, evaluations and the same protocols that Moderna and Pfizer and Johnson & Johnson went through for adults. So it might take another few days or another week after that turnaround, but we'll see.
Okay, I still have only one left. She feels left out, and I'm like, keep promising her it's gonna happen one day. My other two daughters, they all said they did both doses, so they're good.
That's awesome. Great work, everybody. No further business. We can adjourn the meeting.
Good night, everyone.
That's it.
Good
Good night.
Thank you,
See
everyone.
you all.